Assalamu alaikum. My name is Mohammad Hassan. I am student of Osh International Medical University. Today the topic of my presentation is salivary glands. There are three salivary glands: parotid gland, submandibular gland, and sublingual gland. Now let's discuss in detail the first gland, parotid gland. It is the largest gland of all the salivary glands. It is present behind the ramus of mandible. It lies in the retromandibular fossa plus below to external acoustic meatus plus posterior to mastoid process. Now discuss about parotid capsule. It is made up of deep cervical fascia investing layer of make a fibrous capsule around the parotid gland. This is called parotid capsule. It is now discuss the shape of a parotid gland. It is pyramidal in shape with apex and base. Apex is directed downward and base is directed upward. And now the structure present in the parotid glands are facial or retromandibular vein and external carotid artery. And at the last there is a stenson duct. It is 5 cm long. It can be palpated at anterior belly of the masseter muscle. It opens opposite to the second maxillary molar teeth. The clinical features regarding to the parotid glands are the most common tumor in parotid gland is pleomorphic adenoma. Second is the second most tumor is in parotid gland is parotid swelling, also called mumps. There are two complications regarding to mumps. These are orchitis and pancreatitis. Orchitis is inflammation of testes and pancreatitis is inflammation of pancreas. At last there is freeze syndrome. Or in freeze syndrome, there is a penetrating trauma or injury to parotid gland which will lead to the damage of auriculotemporal nerve or greater temporal nerve. This due to the freeze syndrome, it will lead to two complications: ipsilateral swelling, ipsilateral perspiration while eating, and pain on ipsilateral side. And while shaving on that side, it will cause hyperesthesia or insensitivity on ipsilateral side. It is called freeze syndrome. And next is the parotid abscess. Parotid abscess is the parotid abscess. The pus will spread into our oral cavity. In order to remove that pus, we will do incision 4 cm below, just 4 cm below the angle of mandible. The angle of mandible is present between the body and ramus of mandible. It is 140 degree by birth and it becomes 110 degree in adults. Let's discuss about second part of salivary gland, that is submandibular gland. It is present at anterior part of digestive triangle. It is walnut sized and shape and its weight is 20 gram. And it is mixed type gland because it secretes both mucus and serous secretions. It is J-shaped gland with large superficial part and deeper smaller part. There are three surfaces of superficial part: the lateral superficial surface, inferior surface, and medial surface. Let's discuss about content present in these surfaces. In lateral surface, superficial surface, the content is superior artery and related to submandibular fossa. In inferior surface, the content present in inferior surface is the facial vein and mandibular branch of cranial nerve, which have two further branches, that is cervical branch and marginal mandibular branch. Let's discuss medial surface. Medial surface is present against mylohyoid muscle. Middle part of medial surface is related to hypoglossal muscle, hypoglossal nerve, styloglossal muscle, and lingual nerve. And the other part of submandibular gland is deeper part. It is present below lingual nerve and above the hypoglossal nerve. And submandibular duct, it is also called Wharton's duct. It is also 5 cm long and it opens its secretion into the just lateral to the frenulum. Let's discuss its clinical features. Its clinical features are salivary calculi. Calculi means stone formation. Most 80% of stone formation in salivary glands are found in submandibular gland. And during incision, in order to remove these stones in salivary glands, we do incision. And the 4 nerves are damaged during this surgery. These are marginal mandibular nerve, lingual nerve, hypoglossal nerve, and mylohyoid nerve. Let's discuss the third gland, that is sublingual gland. It is the smallest gland. It secretes predominantly it secretes mucus secretion. It is almond shaped. It lies between mylohyoid and side of tongue. Most common facial artery and lingual nerve damage during removal of submandibular gland. The clinical features are ranula. Ranula is a large mucus retention cyst in the floor of mouth arising from sublingual salivary gland.
Bismillahirrahmanirrahim. My name is Ali Raza. I am student of Hosh International Medical University. Today the topic of my presentation is about peritoneum. First of all, we discussed about peritoneum, then we discussed about function, types and peritoneal fold. Peritoneum in male and female. In male it is a closed sac, but in female it not a closed sac. It has three openings anteriorly. One for uterus, and second for uterine tube, and third for vagina. Then we discussed about function of peritoneum. Its function support and protection of abdominal organs. Then we discussed about types of peritoneum. There are basically two types of peritoneum: parietal peritoneum and visceral peritoneum. Parietal mean outer and visceral mean inner. Parietal peritoneum they lies in abdominal wall and pelvic wall. They are pain sensitive and innervated by somatic nerve, which is T7 to L1. Then we discussed about visceral peritoneum, covered by viscera and innervated by visceral nerve, which are pain insensitive unless some exception. You know, exception is always there. During distended stretchness and ischemia, they are pain sensitive, otherwise pain insensitive. Then we discussed about peritoneal folds. There are two types of peritoneal folds, which are omentum and mesentery. Omentum extended from stomach to adjacent organs. There are two types of omentum: greater omentum and lesser omentum. Greater omentum made up of 4 layers and 4 ligaments. You can zoom here: gastrosplenic ligament, number 2 splenorenal ligament, number 3 gastrophrenic ligament, and number 4 gastrocollic ligament. There are gastrosplenic ligament, gastrosplenic ligament. The content passing through gastrosplenic ligament is short gastric artery and left epiploic artery. Splenorenal ligament, you can zoom here: splenorenal ligament. The content passing through splenorenal ligament is splenic artery and splenic vessels. Then we discuss. You can see here the gastrosplenic ligament is start from stomach towards the hilum of spleen. Then we discussed about splenorenal ligament. Splenorenal ligament start from spleen towards the kidney. Gastrophrenic ligament start from upper part of greater curvature towards the diaphragm. You know about diaphragm. Diaphragm is the parachute-like muscles which divide from thoracic wall to abdominal wall. Then we discussed about gastrocollic ligament. Start from lower part of greater curvature of stomach towards the transverse colon. Then we discussed about lesser omentum. There are lesser omentum are made up of 2 layers and 2 ligaments: hepatogastric ligament and hepatoduodenal ligament. Hepatogastric ligament start from liver towards the stomach, and hepatoduodenal ligament start from liver towards the duodenum. Then at the end, omentum hangs down. The omentum hangs down like an apron from greater curvature of stomach, called policeman of stomach. Why it is called policeman of stomach? Because it prevent from spreading infection. At the end, we discussed about mesentery. The mesentery is the largest peritoneal fold which have connected with large intestine and small intestine. Large intestine with have mesocolon and small intestine with have proper mesentery. At the end we discussed about stomach. There are the muscles which present in stomach are smooth muscles which are longitudinal, circular and oblique. Thank you. Allah Hafiz.
Assalamualaikum everyone, my name is Ayuba Mansoor. I am the student of first year Hosh International Medical University, Today my topic of my presentation is digestive system. As we know that we have various parts of digestive system. It starts from the mouth. After that we have tongue, teeth, we have pharynx, we have liver, gallbladder, we have pancreas, large intestines, small intestines, and lastly we have rectum and anus. Starting from the mouth, we have two parts of mouth, that is vestibular part and oral part. In vestibular part, in vestibule we have two parts, that's extrinsic part and intrinsic part. In extrinsic part, it includes lips and cheeks, and intrinsic part, it includes gums and teeth. The second is oral cavity. Oral cavity have two parts, that is roof and floor. Roof is made up of the hard palatine and soft palatine. Hard palatine, it covers the 2/3 part of the oral cavity, and soft palatine, it covers the 1/3 part of the oral cavity. Second, we have the floor. The anterior part of floor is made up of tongue and frenulum. As you know that frenulum, it is a fold of mucous membrane which holds the tongue. According to the clinical features of soft palatine, we say the patients to say ah. The second part of the digestive system is tongue. Tongue is the mass of striated muscles which is covered by the mucous membrane. We have two types of muscles in tongue, that is intrinsic muscle and extrinsic muscles. Intrinsic muscles is longitudinal, transverse and vertical, which makes the shape of tongue, and in extrinsic muscles we have a mnemonic, that is hip, tense, stylish and genius. H stands for the hypoglossous muscles, and P stands for the platoglossous muscles, S stands for the styloglossous muscles, and G stands for the genioglossus muscles. These four muscles help us in movement of tongue. And the innervation of tongue. The innervation of tongue, we have two innervations, that is lingual nerve and the chordatic tympanic nerve. The chordatic tympanic nerve is responsible for the taste. The third part of digestive system is teeth. As we know that we have two types of teeth, that is deciduous teeth, which is also called as milky teeth, and the permanent teeth. In deciduous teeth, we have a dental formula, that is 2102/20, that we have two canines, one incisor, 0 premolars and 2 molars. And the milky teeth, it remains till 6 years of age, and in permanent teeth we have a dental formula, that is 2123, that we have 2 canines, 1 incisors, 2 premolars and 3 molars. And lastly, we have the fourth part of digestive system, that is pharynx. We have 3 parts of pharynx, that is nasopharynx, which is present behind the nose, and the oropharynx present behind the oral cavity, and the laryngopharynx, which is present behind the larynx. Thank you so much.